So that's perfect, because Fiorella Belpoggi is going to be presenting her work for the first time. For the first time. This has never been disclosed to the public before, and I'm really honored to have her with us. I have known Fiorella since we were both a little younger, and she is one of the world's top pathologists. She is a scientific director with the Ramazzini Institute in Bologna, which is a wonderful place to visit with a very, very talented group of hard-working scientists. And I will not, without further ado, I'll just tell you I'm very grateful that you're here. Thank you, Fiorella.
Thank you very much for inviting me here. I am really very proud to be in this wonderful country. It was like a dream to me because, you know, La Terra Promessa, the Israel, it was something that Italy is very close to Israel from a long time, and so I am very happy to be here. Can I have the large vision of the slide here in the computer? If not, I have to turn my neck. I prefer to have it here. So, I would like to start with the laboratory, because we have the privilege, being Italian, we have also some chance sometime, to work in a Renaissance castle. The castle where we have our laboratory was led to us by a marquise in Bologna, who let every property to the hospital of Bologna. So at that time we were part of the Italian health system, governmental employees we were. But, you know, to support independent science is not so much political sometimes. And so we had to find, during our 40 years of life, other kind of organization. So we are in the castle, but the name is Bernardino Ramazzini, because he was a doctor in the 18th century who firstly said it pays more to prevent than to treat. And so in name of this Italian doctor from the University of Padua, all the preventive and occupational medicine in Italy is named to this doctor. There is a history in our laboratory, and I am really pleased to invite all of you to visit our laboratory if you want. Some of you went there, and you know that is really a beauty, a Renaissance beauty. We have frescoes. It's a very nice place. And then there is also a very nice staff working there. We are very passionate with the mission that Cesare Maltoni, our mentor, gave to us. We are really very much concerned about public health. And the nomination of our work is just in the view to find independent results and to apply them to the public health. So now, as I said, we are no more a governative entity. I was an employee of the Italian government until 2003. Now we are a cooperative. What does this mean? In Italy, the cooperative after the Second World War were very strong, where the organization of citizens then rebuilt Italy after the Second World War. So every citizen paid a quote, and they founded an enterprise, a company, that is with no profit. So all the income is invested to have more results. And this happened to my institute now. We have 27,000 associates. So what they do? They collect money and they allow us to survive. That is, for an institute like our institute, completely independent from industry, from the production, from the internal gross income, is that in English? We are completely independent from the economical issue. We do just our work because these people guarantee us to survive, not to be rich, but to survive. So from the early 2000s, for the reason that she said, and also Ron said, both NTP and the Ramazzini Institute started a project on electromagnetic field, in particular on radiation from the mobile phone. Ron at that time went to the castle, if I remember well, and Perry Wilson of NIST, of the same agency you used for your exposure system, went and verified if everything was correct. So we started, but why do we test animals, rats or mice? Because we use a human equivalent model. So what is very important when you use a strain of rat, a particular strain of rat, that the pathologies of these animals are similar to those of humans, to the expected pathologies in humans. So the tumoregram, we call it this line that is growing with the age, is the same both in rats and humans, but they live only 3 years. So this study is comparable to 90 years of life in humans, and you can be predictive. This is an example of that. We had the occasion, I know that Elia liked very much this figure, it's true? Because we had the occasion to have the cause of death of all people died at the hospital in Trieste, because the doctor, Professor Giarelli of the University of Trieste, had the permission to perform autopsy on all dead people of any age for any cause in that hospital. So in 1 year he had 2,000 people dead there, and we could compare the observed neoplasia at death with the observed neoplasia of our rat, and the distribution was very similar, as you can see. So let me move to the experiment. The nomination was done on the basis of the fact that billions of people are exposed to mobile phone, and there was a real inadequacy of animal studies. They studied something that is more close to the near field, to the antenna of the mobile phone. We did an environmental situation. So we exposed our animals to the same intensity that is in the general population with the antenna of the radio base station. So decreasing intensity, because it's stronger, the one of the phone, but of the same type. So we started prenatal, they started prenatal, the rats were Sprague-Dawley rats. We observed them until spontaneous death, because as you have seen, the most part of tumor are in the last part of the life, to make the model more sensitive. What happened? They have seen tumors of the brain. At that point, we have evaluated 3 groups of animals. The brain of all animals, male and females, of 3 groups out of 4. And I cannot make public the results because I would like, for our experience of the past, I know that is the good way, I would like to have a pathology working group, open, international, external, that evaluate the lesions that we have observed before making them public. The issue is too much important to avoid this step. For the heart, we have also evaluated 2 groups out of 4, and the same thing. I hope that the National Toxicology Program, the National Institute of Environmental Health, that already organized pathology working group in the past, could also this time organize something to review altogether the whole project, the National Toxicology Program 1 and our project. So the data will be very homogeneous. But there is something that I can announce that was a clinical observation during the experiment. The National Toxicology Program have seen that the weight of the pups at birth in the exposed animals was lower. We have already evaluated this data. We have performed biostatistics, and we have seen that we have also a highly statistically significant decrease of weight of animals at birth. So something, let me say, that our study could reinforce the results of the National Toxicology Program, and it is very, very important to conclude the study with them. So I hope that the regulatory agency, the government, the institute, the university could help us in completing this study. We are really open to collaborate, to co-work, to put the name of the people who are working with us in the final report, but we need help from all the scientific world. So we also plan to complete the study, the review of slide, for the end of this year. You say tomorrow, the rest of the... But I would like to conclude this presentation with the words of my mentor, Cesare Maltoni. He said, "In the field of experimental and environmental carcinogenesis, words overlap facts, opinion overlap data, and meetings and commission reports submerge good laboratory work." I hope this is not the case. I really strongly ask for the regulatory agency, for people who works in the world of evaluation of risk, to be very fast, to be very open to review the actual classification as possible carcinogenic, because I think that now new data could help in doing better. Thank you very much.
Well, thank you so much. While Serena comes up to change the slides for Stella, I want to add something very important. The pregnancy effects that she's showing here, litter size and lactation problems, we're seeing in many animal studies, prenatally exposed animals are developing smaller litters, and we'll see tomorrow with smaller brains. And this is a huge implication for what's going on now with our children and schools around the world.